So my name is Evi Bakali. I'm a consultant gynecologist based at University Hospitals of Birmingham, Little Aston, and Spire Parkway. So I decided to become a doctor. I always liked the sciences at school, but I think what the changing part that made me determined to become a doctor was when my grandfather was diagnosed with cancer, and I was very, very close to him. And my interaction of going in and out of hospitals, the interaction, seeing the doctors, the nurses, I think that's what made me want to be do that as my future career, to be there to also help people, like how the doctors and the nurses helped my grandfather. That's why I decided to become a doctor. So I chose my specialty while I was in medical school. Initially, believe it or not, I wanted to become a psychiatrist. I did my first attachment as a medical student in obstetrics and gynecology, and I think when I delivered the first baby, when I saw the delivery of the first baby, that just brought tears in my eyes, and then I thought, this is what I want to do, and then just spending the time seeing the surgeries, the being involved in delivering babies, and also helping women. I think that's what then marked my decision to follow gynecology as a career. So I grew up in Athens in Greece. I went to an American school in Greece. So I did the international exams, the international baccalaureate exams to get into university in the UK. I finished my medical school in Leicester, and then did the majority of my training in East Midlands, and then finished the remaining of my training in the West Midlands. And then I became a consultant at the University Hospitals of Birmingham. So the most rewarding about my job is when I've seen a patient in clinic, and I can see how distressed she is because of her problem, and then together we've made a decision for treatment, whether that's surgery or medicine or medication. And then when I next see her back, and she comes in as a complete different person and tells me, oh, my quality of life has improved. This has changed my life. And that makes it worth it. That just makes just seeing that change in her face, the happiness, that makes it worthwhile. So what my patients value most about me is that I listen to them. I work with them to find a solution to their problem. They value that I'm honest with what I tell them, and about the different management options, and they don't feel they're pressurized into deciding for surgery, for example. So we work together to get to the bottom of their problem, and I make them feel comfortable, so they're able to open up, they're able to cry or laugh, or they just feel comfortable when we're sitting in the consultation, so they don't feel intimidated. I think that's what they value the most.